Hi.
And welcome back. Well, female sexual dysfunction, or FSD, is a complex disorder with a wide spectrum of symptoms. And yet so many women suffer because you're too embarrassed to talk about it, right? We don't want to say anything, but we're not. So we're going to talk about it. Joining us now from Wisconsin Vein Center and MediSpa is Dr. Deborah Mangione, who brought on Dr. Joy Davis to expand their services to counseling and treatment for FSD. And it's great to have you guys here. Thanks for being here.
Thank you.
I love this because I think it's so uncomfortable for people to talk about because you feel like maybe you're less of a woman or something's wrong with you or, you know, whatever it may be. It's a problem in your relationship. So a lot of women don't want to talk about it. Is that where you find this coming as a need?
I think that's exactly right. And, you know, especially as women get older, there's a higher percentage of women who are going to suffer from this, but even young women do. Is that correct?
Yeah, I mean, a lot of premenopausal, even younger, but especially postmenopausal women, it can be as high as 75%.
Wow.
Sexual dysfunction. And a lot of those, probably 40%, are due to vaginal dryness and changes with aging and hormone loss.
Yeah. What's your background that brought you to this topic?
I'm a board certified OBGYN and took on the laser procedure as an option for women because we really didn't have a lot of things to offer. And certainly women should start with the more acceptable things like hormones, you know, lubricants, but a lot of times that doesn't work. So I, you know, championed this several years ago, and it's been a great experience. It's been great to join Dr. Mangione. You know, the staff is great and very professional and well trained. And
I think that's what women like too, is they know that it's confidential. B, it's comfortable. You're meeting with other women who understand and work with this daily, so it doesn't need to be embarrassing. Let's break down some of the symptoms though, because I want people to know what they may be experiencing is normal. Yep. And some of the symptoms are?
So there's vaginal dryness, burning, itching. You can have more frequent infections, bladder infections.
I think that's the one thing that I didn't know, certainly.
Yeah.
That urinary tract infections can be caused by this hormonal change.
Interesting.
So even people who never had urinary tract infections in their life all of a sudden do as they get older.
Gotcha.
And even leakage of urine.
Which a lot of women think or have after giving birth.
Right, right.
That can happen. It can get worse when hormones decrease, and you know, the laser that I'm doing is the CO2 laser is really showing the most promise for helping these women.
Well, let's talk about the laser. Is this the laser that's called the FemiLift?
Yeah, the FemiLift is a fractionated CO2 laser, and what it does is it treats small areas of the vaginal tissue, leaving normal tissue around it for more rapid healing and less downtime. And it improves the thickness of the vaginal wall, so you feel less laxity, more lubrication. It brings in blood flow, and it has really worldwide shown to be helpful.
So there's tightening effects, there's strengthening, right? And there's and all those things.
And really has made a remarkable difference for a lot of women with this stress incontinence.
Yeah.
That's what they've noticed right away.
If you laugh and you pee a little, you sneeze and you pee a little, you run and you pee a little, all of those things, you know, can be potentially solved with this procedure.
That's right. This is not FDA cleared for that in this country, but worldwide it has really shown to be very effective because there are many, many studies that have looked at and seeing up to 90% improvement in these symptoms with this type of procedure.
So you're looking at, for something like this, roughly 3 treatments, is that correct? And how long do the results last?
So the 3 treatments take about 10 minutes, are done about a month to 6 weeks apart. And
does it hurt?
It's there's, you know, some mild zinging, but I will use a topical anesthetic to minimize that. So it's fairly comfortable. Yeah, there's you know, you can go back to normal activities afterwards, and then the effects, probably the maximal effect is in about 4 to 6 months. Yeah. And then they can last from anywhere from a year to 2 years because we're constantly battling aging. So some women need some touch-ups.
Which makes sense. Then as you get older, you might need to do some touch-ups and some changes. I want to make sure everybody has an opportunity to get this consultation, because if you mention the Morning Blend, there's a $25 consultation and $200 off of any series of 3 treatments. That's again called the FemiLift. And again, it's at the Wisconsin Vein Center and MediSpa with Dr. Joy Davis. WIMedispa.com is the website, or call for that consultation at 262-746-9088. Again, mention the Morning Blend when you do that to get that discount and that special. And again, confidential, comfortable, and definitely something we should all be talking about.
It's a serious topic, but we can have a much better happy ending.
Yeah, yes. Perfect. You said it best right there. Thanks, you guys.